Since the 1990s, physician-assisted suicide has been a major controversy. Physician-assisted suicide is suicide by a patient facilitated by means or by information provided by a physician who is aware of the patient's intent. Many people suffer greatly during their illnesses or end of life, and assisted suicide helps them to relieve them of that pain. Few states legally allow assisted suicides, but it comes with many requirements and steps to follow to ensure that it's the correct path to take. It's understood that with assisted suicide comes many ethical issues, but in the end it's about how the patient wants to spend their final days, either suffering or not. Physician-assisted suicide should be permitted to allow a person to end their life due to a painful or incurable disease. Physician-assisted suicide came about when Dr. Jack Kevorkian found a way to help patients relieve their pain. As a pathologist in Michigan, he began to assist people in ending their lives due to suffering from certain medical conditions. His career started out at the University of Michigan Hospital, where he was serving his residency in the 1950s. During this time, Kevorkian became fascinated by death and dying. He would make visits to terminally ill patients and photograph their eyes when they died to try and pinpoint their exact moment of death. Kevorkian believed that doctors could use this as a way to distinguish death from shock, coma, or fainting in order to learn when resuscitation was pointless. Around this time, Kevorkian's reputation started going downhill. He received the name Dr. Death and was getting fired from job after job. In 1986, he discovered a way to help people die by lethal injection. He began a campaign for medical experiments on the dying by writing medical journals about the benefits of euthanasia. Kevorkian created a suicide machine called the Thanatron, which consisted of 3 bottles of fluids. The first was a dose of saline, and then a painkiller, and followed by a fatal dose of the poison potassium chloride. In 1990, Dr. Kevorkian became infamous when he assisted in the death of Janet Atkins. Janet Atkins was a 54-year-old Alzheimer's patient. She was a member of the organization called the Hemlock Society that advocates euthanasia for terminally ill patients. After she became ill, she searched for someone to help end her life before the disease took over. So she contacted Kevorkian, who agreed to assist her in her death. He attached the IV fluids, but she administered her own painkiller and poison, and within about 5 minutes, she had died from heart failure. The state of Michigan charged Kevorkian with Atkins' murder, but the case was later dismissed due to the lack of Michigan's stance on assisted suicide. Eventually, Kevorkian was put in jail, but released later on due to good behavior. In 2011, Jack Kevorkian had passed away at the age of 83. Currently, there are 5 states that have legalized assisted suicide: California, Montana, Oregon, Vermont, and Washington. However, there are specific requirements in each state that the patients must meet and follow concerning assisted suicide. In order to go through with it, the patient must be 18 years or older, a resident of one of the 5 states, and a victim of a terminal ill disease that will take their life within the next 6 months. The first step a patient must go through is to make a formal oral request, and then 15 days later make another one. After that, they must file a written request form signed by 2 witnesses. The physician then needs to assess the patient for a psychiatric or a psychological disorder, and it's also required that they tell the patient about alternatives such as hospice, talking to their family about the decision, and then reminding them that they can change their minds. After the assessment, a second physician needs to review and sign off on the case. So it's clear that the physician-assisted suicide is an extremely serious matter, and in order to go through with it, laws are made extensively to give the patient time to finalize a decision. The way the laws are set up for this help ensure that the patient is happy and helps take away from some of the ethical issues that may be involved. One of the major things that physician-assisted suicide is different from euthanasia is the patient must administer the lethal drug themselves. Euthanasia is when the physician administers the drug and can either be voluntary or involuntary. For physician-assisted suicide, doctors can prescribe lethal drugs 2 days after the request. So currently, the debate about physician-assisted suicide continues. Morally and ethically, it may seem wrong to a lot of people, but in the end, it is only helping relieve patients of their suffering and pain. Professionally, doctors swear by the Hippocratic Oath. Legally, many requirements for going through the process ensures the fair treatment of patients to the best of their ability, and if they make the decision to end their lives, then it is in fact the right decision. Most of the cases of people involved in assisted suicide want to die on their own terms, rather than be killed by an incurable illness. All in all, assisted suicide has more advantages than disadvantages and helps patients to die peacefully and happily.